So we'll call on our friend Dr. Shrinivas Joshi, who's always buzzing and always busy, and he's going to talk to us about fast and futuristic Hypervit cutter technologies with AI inbuilt.
Thank you so much. I would like to thank the AIOS and the Alcon for giving me this talk, and thank the respective panel for accepting my request to little bit push me up in the order is because of the other presentation clashing, and my sincere apologies to the rest of the speakers. So I have no financial disclosures for this presentation. So we all know that with the dual blade technology and the bevel tip, the dual pneumatic design, and Alcon says that it's nearly around 100% of duty cycle which is achieved at 20,000 cuts per minute, while reducing the acceleration of the vitreous contents into the lumen, which provides both efficiency and the safety. So these advanced ultraviolet beveled high-speed probes, they provide increased efficiency by improved duty cycle, more flow for faster vitreous removal. So the bevel tip also provides closer proximity to the retina, allowing more access to the tissue planes. Now, if you see this video, the closer proximity to the retina in the Hypervit designed for improved efficiency and the stability and the less turbulence. So I'll just come back to this videos after this animated videos. Now you can see these particles coming up into the cutter with less chattering on the left side, with more chattering on the right side. So how does it implicate? Hypervit probes, according to the Steve Charles, published in the Retina in 2022, has said that probes result in 44% greater maximum flow rate, respectively, as compared to the single-cut ultraviolet, which was the 10,000. And less pulsatile traction has potential less risk for iatrogenic retinal breaks. So I'll be speaking about the sphere of influence. It's about for the enhanced safety with high precision for the vitreous removal, especially when it's the mobile or the detached retina. So now you can see this video, which I've showed in one or two meetings. If you can recognize the left and the right. So it's very difficult to recognize which one is with a 10K and which one is with a 20K. You can see almost a similar turbulence on both the sides, right? So now let's see what it was. So left side, if you see, it is a 10K, and the right side, if you see, it's a 20K. In fact, we see a little more, some people say that turbulence is seen, but it's almost similar on both the sides. So now if we look at this turbulence, yes, definitely we see the right-hand side is more higher as compared to the left-hand side, is because the right hand I have used the vacuum as 650 and the left hand I have used the vacuum at 450. So which indicates that lesser vacuum is definitely better for initially for the learning curve when we are using the Hypervit blades. Now, let us see this in the detached retina. How does it work in the GRTs? So in GRT, you can see my vacuum is around 300 because this was the initial set of cases which I was operating. Definitely, I could see less mobility of the retina as compared to the 10K cutters. And definitely, you can see the sphere of influence, the vitreous coming to the cutters. The other advantage is you can go more closer to the edges of these retina and trim the retina. Of course, everything is on the vacuum. You can even trim the retina without having more iatrogenic retinectomies. So what does this indicate? Potential reduced acceleration of vitreous content into the lumen, and experimental studies have shown that 28% reduction in the peak traction forces of the vitreous in the Hypervit probes. So now you can see the closer proximity to the retina. Even I have increased the vacuum a little bit, but definitely there is less fluttering. So now we compared how close can we go to the retina, and then we use the ImageNet software and try to compare it. So we kept at it, if 0.5 millimeter is the diameter, then it corresponds to 14 pixels. So we analyzed it using the ImageNet software and how close we are going to the retina, and we saw that at 0.21 or even with 0.19, there was as close to retina without having much fluttering of the retina. So now you can see the scale here, it's around 0.21, and then when we again set it clear, because it is a preset, so how much ever we zoom, it doesn't differ, because we have set the scale as 14 pixels for 0.5 millimeter. So again, if you can see here, it is 0.19. So you can go more closer to the retina, and that shows the efficiency of these cutters. So now, some people argued in the last meeting that you are using a PFCL, you are using the indentation, you are using a double effect, then how will the retina move? So I thought, let me see how it works even without PFCL or without indentation. Now you can see here, all I said is about the vacuum. The vacuum I have kept is very low, but you can see the cut rate remains stagnant. And now you can even cut the retina. It was a case of bullous rheumatogenic retinal detachment. You can even cut the periphery of the vitreous. We see very less movement of the retina. Of course, you need to have a good pedal control, good control over the vacuum. So when I said visualizing the sphere of influence, here we tried the chromovitrectomy using a fluorescein and using the digital filter. So we can see how the vitreous comes to the cutter. So just wanted to show it in this video. And now, as Parveen madam beautifully showed how with the cutter, how with the scissor she is able to do it. But now, even with the help of the cutters also, we can do most of these jobs. These cutters are acting like a multifunctional tool.
Last 1 minute, huh?
Yes. Cutters are working like a multifunctional tool where you can see here, cutting most of these membrane, doing a cutter segmentation, cutter delamination. Although I do not say that it's a universal and you have to do with the cutter in all the cases. I am a big fan of bimanual technique as well. But definitely the cutters are doing a more better job nowadays using a good multifunctional tool. So here I'm going more close. And once the dissection is done, fluid air exchange was done, and this is the 1 week post-op image of that. And lastly, just 10 seconds, I would like to show, even in the detached retina here, this was the case of combined rheumatogenic retinal detachment. And you can see, just demonstrating, the fluttering is relatively less as compared to the 10K. You can see the vacuum, again, it remains low. And definitely you can achieve a good vitrectomy without having much iatrogenic breaks, even in the highly mobile or the detached retina. I'd like to acknowledge my colleagues and thank you very much for the patient listening.
Lovely presentation. Lovely. Good videos.